Hi there. Today we're going to be tackling a serious subject, and as I was doing research I saw that September is Suicide Prevention Awareness Month. So, heavy topic, but something we really need to talk about and try to reduce the stigma so that people can get the help that they need. Around the world, the incidence of suicide is about 12 per 100,000 individuals. In the United States, it's about 15 per 100,000 individuals, which makes it the 10th leading cause of death. In the year 2016, there were about 45,000 deaths by suicide, and the translation here is that this is a serious problem and we need to get people the help that they need. We also think that the numbers tend to be underreported, as many of them are either misidentified as accident or unintentional deaths, so it's probably quite a bit higher than what we read in the research. Researchers estimate that for every suicide, there are about 30 attempts, which tells us this is a widespread problem. Underlying things that lead to suicide attempts are depression, schizophrenia, bipolar disorder, substance abuse, isolation, personality disorders, and the list goes on and on. But there are many things that can make someone more at risk. Interestingly, we think of younger people as higher risk of suicide, but also people over age 65 have a pretty high percentage of suicide deaths too. There are a lot of different layers that hinder people from seeking mental health care. One of those is that there's still a stigma attached to mental health issues, and I would love it if we can start to unburden people from that stigma. They would seek treatment for high blood pressure, so I encourage people to talk to me or talk to whoever they need to about getting the health care that they need. There are also still many discrepancies among different ethnic groups on having access to good health care in general, but certainly mental health care too. And some ethnic groups just don't acknowledge that mental health is an issue. And so these are some of the big hurdles that people might face, and I'm just here to tell you that it's okay to ask for help. So what can we do to help? Of course, trying to get people in touch with resources is good. There are certain things that are protective factors against suicide attempts. Having a good family and a social network, being connected to whether it is a religious group or some other sort of interest group, having those close relationships helps people feel more secure and feel like there is a way out of the situation they're in. Interestingly, parenthood and pregnancy also seem to be protective factors against suicide. If you are someone who's struggling with this, call a friend or a relative and let them help you find access to the care that you need. You can pick up your phone and dial 988, that's the crisis line, or Google Crisis Center in your area. Resources are there, you just have to tap into them. If you're not comfortable going in to sit in a counseling session with someone, they have resources online. You can do virtual counseling. It doesn't have to be during normal office hours. There are people that offer alternate schedules that can fit with it. Don't make excuses for this. If you are somebody who is in a situation where you know somebody who might be at risk, check on them and have frank discussions with them. It's not an easy subject to broach, but you really could save somebody's life. Just remember, there's no extra points for suffering, so please don't be bashful. Talk to your friends, talk to your relatives. Don't forget to like and subscribe, and stay tuned for more.